my name is Mary Carcavino from BSN 21, and I will be talking about the AGPAR scoring. The AGPAR score is named in honor of Dr. Virginia AGPAR, one of Columbia University's first female MD in 1933, one of the first American women to specialize in surgery. Dr. AGPAR realized that birth is the most hazardous time of life, so she created a system for quickly and accurately assessing a baby's health in the crucial minutes after birth. The intent of this scoring system is to help identify newborns at risk of complications. A score is given for each sign at 1 minute and 5 minutes after birth. If there are problems with the newborn, an additional score is given at 10 minutes. A score of 7 to 10 is considered normal. 4 to 7 requires some resuscitative measures. A score of 3 and below requires immediate resuscitation. For AGPAR scoring, for appearance, give a score of 2 if the infant is pink, a score of 1 if the extremities are blue, and score of 0 if the infant is cyanotic or pale. For pulse, give a score of 2 if it's greater than 100 beats per minute, a score of 1 if it's less than 100 beats per minute, a score of 0 if there's no pulse. For grimace, give a score of 2 if the infant cries and pulls away. This is when you stimulate the infant. If you tap the sole of the feet, then give a score of 2 if the infant cries and pulls away, a score of 1 if only grimaces or weak cry, and a score of 0 if there's no response to stimulation. For activity, a score of 2 if the infant has active movements, a score of 1 if the arms and legs are only flexed, a score of 0 if there's no movement. For respiration, give a score of 2 if the infant cries a lot, and a score of 1 if the infant has slow and irregular respiration, and a score of 0 if there's no breathing. The purpose of this procedure is to assess the well-being of the newborn. For the assessment, assess for the following. Color. All infants appear cyanotic at birth and become pink with or shortly after first breath. For the heart rate, auscultate the newborn's heart rate, place the bell of the stethoscope under the infant's left nipple and count the heart in 1 full minute. 2 beats is equal to 1 count. Reflex irritability. Response to a suction catheter or having the soles of their feet slapped. Muscle tone. Newborn hold the extremity tightly flexed. They should resist any effort to extend their extremities. The planning, prepare the following materials: pre-warm curb or bassinet, stethoscope, adequate source of light, a pair of sterile gloves. Let's begin the procedure. Observe the newborn for their appearance, if they're pink, has blue extremities or pale, if they're active or they're only flexed, the arms and legs, or if there's no movement. Also check for respiration, if they're crying, or if there's slow, irregular respiration, or if they're not breathing. Auscultate for the newborn's pulse. Slap the soles of their feet to see if they're going to grimace, if they're going to cry, or if they're going to pull away, or if there's no reaction at all. Pull on their extremities to check for their muscle tone. Keep the baby warm after the procedure. Remove gloves and do hand washing. Document the procedure on the baby's chart. Thank you for watching!